Good afternoon, everyone. So we have a really amazing panel. It's all about strengthening the validity and use of data to address the social determinants of health. There have been a couple of themes that have come out across the course of the day that our panelists are actually all going to address, which is as nice as a capstone to the day. Thinking about storytelling and data translation, data visualization, as well as data sharing and transparency, all of which are really critical for figuring out how we really strengthen the quality of our data and figure out how to align it across institutions and sectors, and think about making sure that we really have the data that we need in order to make the decisions that impact our community. So I wanted to first welcome Katie Bachmeyer, who's a research storyteller at Starfire. Then we'll go on to Michael Topmiller, who's a health GIS research specialist at Health Landscape, followed by Dr. Robert Kahn, who's a professor of pediatrics at Cincinnati Children's Hospital Medical Center. So first, Katie.
Oh, God. I've been having nightmares about this moment for the last 2 months, so luckily I'm clothed right now, which is good. That's a start. I am the researcher storyteller at Starfire, so I do their data collection and their storytelling. I'm not typically the person to get up and speak and present, and I'm really honored that Jennifer asked me to do this. I do think we have a really powerful story, so thank you all for staying to hear this. So what came up during lunch was interesting. We had a small group at our table discussing wellness and social connection for people with developmental disabilities. It's one of the biggest issues facing them today, and I think it's also one of the biggest issues facing people in our country today. Social isolation is a very big issue, and it impacts all of our health. But so today I'd like to just kind of talk about how in our work, outcomes can really be used as a way to either prop up the system, or it can be a way to stand up for people and real impact. And Starfire had a big wake-up call around this issue. And around our data. And we decided that we were going to stop perpetuating social isolation. We were going to stop using data that was propping up our own system, and instead we were going to start serving people through our data and through social connection, and so propping up people through this transformation. I don't have a clicker. Is there? Thank you. All right. So, how does this work? There we go. So over the last 20 years, Starfire was a hub for people with developmental disabilities to come. At our height, we had 100 social outings on a calendar per month for around 500 members with developmental disabilities. And what this means is that people were getting in a van, much like this one. They were going together to Reds games or out to eat or volunteering with a staff and a volunteer from the community. And we also started a day program, which is a center for adults with developmental disabilities to come and learn life skills, like cooking and creative writing, and also go on day trips. So you may have seen our van around town here with our logo on the side. Here's how we were measuring our impact then. And one thing I want to note is just that these were developed, one by a university, a local university, but the other two were developed strictly by Starfire. They did come from some research, but for primary purposes, they were something that we developed on our own. So the first set of tools here was listed a number of skills, life skills that a person should learn, and there was actually around 200 life skills that staff would sit down once a year, and it would take hours for them to go through, whether or not a person had accomplished these types of skills throughout their year and throughout their learning with us. There was a lot of guesswork involved because we weren't there in the morning to know if they made their own bed, so that was kind of a problem. And then the next was an outing evaluation that staff would fill out after one of these outings. And as you can see, one of the determining factors was a checkbox, is whether or not they made eye contact during that outing. The next was a perception survey from parents that we would ask them to fill out once a year. It was a 5-point scale. And we just asked them questions to agree yes or no to questions like, is the Starfire member less lonely or isolated because of his or her involvement with Starfire? So that was something that the parents or the caregivers filled out on their own. We knew that there was something missing here. Everything was telling us that we were wildly successful. No one was telling us otherwise. But there were these other numbers, these other statistics about people with developmental disabilities that were really sort of glaring and present in our work. And after knowing people's stories for 20 years, we really knew that these were not just statistics, they were people that we knew well. So this chart represents an informal study that was done in the 90s, and the questions asked were just who's in your life. And on average, it was found that people with developmental disabilities have a few close family members. They have around 20 paid staff, people who come from the day programs or therapists or special education teachers. The largest group by far were other people with developmental disabilities, right? And that was contrasted by the smallest number by far, which were other citizens and friends without disabilities. So when you think about this kind of isolation, it's not really hard to imagine why parents are asking us, who's going to love for my son or daughter after I'm gone? Who's really going to care for them as they age? At the start of our program today, 2 decades after that study was done, that's the same picture of social isolation that we see. Members report having only 2 community relationships. So when I applied for my job at Starfire, we were at the tail end of forming a new strategic plan. And Tim, our executive director, was in search of somebody who would develop outcomes during that transformation, this transformation that we were going to be making. And I came in and he was great. He told me, you don't have to come in with any of the answers. I just want you to observe. Use your background in anthropology to take a back seat and draw out the measurements that may be hidden in the narrative side of our work here. So up until this point, Starfire's data had only taught us really one thing, and this is what I was learning, that what we were measuring was not actually congruent with meaningful impact. So we knew people who were being prostituted, people who were being jailed, abused by their caregivers, and people who didn't even attempt to join the workforce. We knew people who were chronically depressed, stressed, and anxious. And the common denominator in all of these stories, after 20 years of being an organization serving them, was not that they weren't learning enough skills to be independent or that they weren't having enough fun, or even that they were living with a disability. What spanned across all of these stories was the sheer isolation that each person we work with faces. So it dawned on us that even if 100% of our members learn to ride the metro or make strong eye contact, they were still at risk of becoming a statistic if they didn't have anyone in their life. So Starfire, being the hub that we were, had been providing a separate special place for people. It was a proxy for what community might feel like, but it was without the benefits that actually belonging in the community gives you. So how many of us landed a job because of tapping into our social network? 80% of jobs are gotten that way. Who can you count on in an emergency, or if you're having a terrible day, who do you celebrate your life with? Who are the people in your life? Starfire doesn't want the way that we supported people to reflect to the community that people with developmental disabilities belong with their own kind, that they belong set apart in special places. So our commitment now is instead to open the hearts and minds of others, so that the people that we serve can gain access to real relationships with people who share their common passions and their interests and can be there for them in a time of need in a way that only neighbors and friends can be there for you, especially when you've got certain limitations, right, that put you at greater risk. So social connection became our new beacon. And this is how we're different. This is how we're changing lives now. We have transformed from an organization that groups people into a one-size-fits-all service to working closely with one person and their family at a time to build meaningful connections that lead to sustainability and personalized impact. So every outcome looks different, right? But it's through these social connections that we're doing it. So instead of measuring what a person's social life skills were, or if they had social life skills, we started to measure whether a person had a social life, right? That was our starting point instead. And how does that affect their well-being? So success is now determined by how good we are at fostering community relationships and connecting people to places in their community where they can volunteer or work. And we didn't want to just measure things anymore by checking a box, right? I recently sat in on a meeting with one of my friends who has a disability, and when the topic of employment came up, it was described to be an initiative by Governor Kasich to make sure that all people had integration in the community, that all people, no matter how severe their disability, have a place to belong. And I was like, yeah, like this is totally what we do. I'm so going to be down for it. And then the conversation that happened after that with this agency went from how do we make sure that Jessica can continue doing what she's already doing, but make that look like employment. So the day program that she was going to said, oh yes, we do community employment, we do career discovery. It's when people go out in groups together and they volunteer. And then the other day program she goes to said, oh yes, we can check that box. We have tasks around the day program facility that she can do, and we'll pay her to do that. So no creativity, right? No creativity. It was a mandate. It was a checkbox. Jessica doesn't get anywhere new. So in Starfire's case, we're connecting people to positions in the community that interest them and are a place where they can be known for their gifts, not their disability. And these connections are measured by this standard, these tools up here. We use these to track a change in their social network over time. We use it to track their participation in community and their well-being. And it's giving staff a new idea of what their work actually is. So the staff, the member, and the family come together biannually to complete these tools together as a unit, and that helps bring the family along so that they can carry this work forward and help us sustain it. And we're also really careful in the language and phrasing that we use so that there's no terminology in there that is unintentionally devaluing people even more. That's why we stopped checking boxes like, does a person make eye contact? Because it doesn't really help the staff understand what their job is. And it really doesn't determine a good life. What matters is how we can support a person by meeting them where they are today and then modeling what it looks like to love and include that person as they are, and then letting go of any desire to fix or change them. So building that culture takes collaboration, right? Going from an organization that doesn't really think data is valid, where you can see on the left side of this picture, these are stories that staff had to let go of. Data is invalid. It's used to scrutinize me. And then this is on the right-hand side, what they're starting to see. It is something that actually validates the small victories of my work, and in that way it is freeing. So to date, this is the number of hours we've worked with people one-on-one and counting. We've moved from our pilot phase to our program phase this year. Staff have also been leading mentoring sessions with families. Valued roles in the community have been, blowing up since 2012, and we have a great success rate in our increase in people's social networks and valued roles. This is our baseline data. We're just seeing it now. So just to kind of finish, I do have a video I'd like to play, but first I just want to kind of add that I've learned quite a bit over the last 4 years. It's been a privilege to be part of our transformation, but good results and good numbers, what I learned, only really have value, as Father Greg Boyle put it, when they're a byproduct of our fidelity. And they actually have the capacity for harm when they are driven by something that's more detached or unaware or devalues the people being counted, and especially when it's done in the name of organizational scale or fundraising or longevity. So, Lorraine, you're shaking your head that I don't have time for this video, but it's getting played. I don't know.
Before I met Nikita, my Mondays were empty.
I didn't know that I was going to like teaching as much as I did.
I didn't have as much richness in my life.
Oh man, how do you articulate that? It just...
You can grow so much from people that are different from you.
I have somebody to pray to me, Brianna. So I finally met her. one day in November.
You learn that you get through everything, and it just takes a little bit more time, and there's nothing wrong with that.
Boy, I have grown up since then. I know so much more about life than I did 4 years ago.
Very, very good.
His very presence brings a certain light and a certain joy to the room. And so just by being who he is, I think that's a blessing.
Good friends.
And all of these moments just might find their way into my dreams tonight. But I know that they'll be gone. Morning light sings or brings new things.
Becky has helped me to slow down and to really, embrace every moment and every detail.
As a parent, you kind of need somebody to provide some direction and insight as to what's really out there. And I think Starfire lends itself to providing that exposure.
It made me feel happy.
She's very supportive in everything I've been doing.
I'm able to share some of the stuff I have, and he's able to make a little bit of money, and we really like spending time together, don't we, Alvin? We have a really good time.
At least I know what I learned from this program.
What's that?
That there are good people out here.
It's kind of hard to put into words, but just being around, like his presence has made me grow as an individual, is like all around, like my character as a person, as a human being.
You've taught me different ways of communicating and a different way of looking at things.
I feel like we're good friends, and I really appreciate that friendship with Matt. He brings a lot out here.
He's a good guy.
Thank you, Mike. You're a great guy too.
Thanks.
Well, you ended up becoming one of my best friends, I think.
Thanks.
Yeah.
You helped fill a spot in my heart. And we get a lot of laughing done.
How you like that?
That.
Mm-hmm.